University of Toledo. And also, she's a public affairs specialist in Social Security Administration. And she's been avid speaker in the public radio space with several stations, and also writes several columns. And Our second speaker is Chikaya Hagabuk, a native of Detroit. She also works with the Social Security Administration, and she's a public affairs specialist, and has several outreach and media presentations in several counties here, Wayne, Oakland, and Macomb counties. And prior to this career, she also worked for the IRS. So with that, I would leave the floor for Sarin. Let me bring up your slides and share.
Perfect. Thank you so much. I will put some links in the chat as well. Thank you all for tuning in today. I'm happy to be joined by Takia. I was intentionally going to do the entire presentation, and then I got called to a funeral. And so I appreciate her filling in for me. I'm going to stay just as long as I can. But we did receive some questions in advance, and they will be covered throughout the presentation. There was only one question that is not part of the standard presentation, and we will make sure that we cover that as well. Social Security, we title this, We Are With You Through Life's Journey. If you can put it on the slideshow view. Yes, thank you so much. The most important thing, we're going to just dig right in. I'm going to have you go to the next slide. So that the most important thing that all of us can do to see what Social Security has for us, back up just one, please, is make sure that you have created access to your own personal Social Security account. And this is for anyone that is 18 and over and has access to email. Previously, you had to be in the United States to do this and to access your account. However, in the last several months, I think it was about December, the agency has allowed, we have went through a process to allow you to log in other countries as well. If you are a U.S. citizen, you can receive your Social Security money virtually anywhere. There are a few countries that we cannot send Social Security money to, but for the most part, you can receive your Social Security money anywhere as long as you are a U.S. citizen. If you are not a U.S. citizen, because this was one of the questions that was sent in advance, if you're not a U.S. citizen, you can receive your Social Security money in the United States as long as you're lawfully here. If you would leave the country under a lawful status but not a U.S. citizen, then your benefits would be in a suspended status while you are outside of the country for a length of time. Now, visits outside of the country under 30 days do not count, but if you're going to be somewhere for more than 30 days, it has to be reported to Social Security. So this site, I do encourage everybody to make sure that you have accessed this. If you have already accessed this, you would have a username and a password, and then you just use that every time you go in. I personally encourage people to go in annually. Every year, go in and check and see how things are being updated for you, because this is a really good pre-retirement planning tool. And we are constantly adding additional things in the site. So the basic is you go to socialsecurity.gov/myaccount and you create your access by coming into our program under either login.gov or under the id.me. So there's two different options to get into the program. login.gov is much easier. It does not require you to upload any documents. So that would be my choice because it's less work. Once you go through the process, you're going to answer very basic questions. Put in your name, your social security number, your mother's maiden name, the address that you last used for tax purposes, and then we're going to ask you some basic credit bureau questions. So the hardest part sometimes is just remembering all of those things. But once you get in, you have your username and password. And when you're setting that up, we are asking you some security questions in case you would forget. Because me personally, I have so many usernames and passwords, I don't always remember them. And so we set it up to where if you ever forget, you can easily have it retrieved. And I've actually done that. It's a pretty easy process. It's just like online banking. Go ahead to the next slide. Again, 18 and over have access to email. Now, it is important that if you share an email with your husband or wife or someone, just know it's one email per my Social Security account. So for our account purposes, you will need to create a different email if you are used to sharing. We can only have one email per individual. For people like you and me, most of us are probably not receiving Social Security, I will assume. And so if you're not, there's so many things that you can do in this account that can help you and save you a lot of time. If you ever need your Social Security card replaced, this is your go-to. You log into your account, you order a replacement, totally free. It will come to your address in about 7 to 10 days. This saves you from physically going to a Social Security office, from driving there, from sitting and waiting. And we do not issue Social Security cards in the office anyways. So really, you're just saving yourself a whole lot of time by doing it online, and it comes to your address just like it would if you come to a field office. Now, this is for replacement cards only. If you're talking about a new card or an update due to citizenship or something like that, you're still going to need to come into Social Security with your proper documents and IDs. Once you file for anything off of your earnings record, retirement, disability, Medicare, or even the Social Security card, you will start to get updates in your account. You can see a status. Has it been processed? It's very nice because when you go in, even for a basic Social Security card, it will give you a timeline on when to expect that, so you can really watch for your mail. You can get a verification of your application if you need it for some place, something, your business, any type of assistance programs. You can get proof of benefits, and you say, why would I need that? Even if you're not a need-based individual, we sometimes, you might need a verification of something for various things. And so it's just nice to know you can pull that up in your account. But for the best thing, I think, is for your retirement planning, your Social Security statement. And it gives you estimates from 62 through age 70, a year-by-year breakdown. From there, you can even pull up our retirement estimator and get a month-by-month breakdown, because your check does go up a little bit every month from 62, which is the earliest you can receive retirement, all the way to age 70, which is the absolute latest. So keep in your head, you have an 8-year window of opportunity with Social Security. We're going to talk about some of the options in just a few slides. Go ahead to the next slide. When you start receiving benefits from Social Security, you still may have a need to come and talk with Social Security or reach out to us. And so, again, if you have the ability, you can go online, you can do these requests right through your portal, your My Social Security account, if you need that replacement Social Security card, or if you have Medicare, then you can get a replacement Medicare card. If you need to update your address, your phone number, your direct deposit. Right now it's tax time. So Social Security sent out 1099s in January and in February. People have lost them, misplaced them, and now they're remembering that tax day is next Monday. So they're scrambling to offices and calling and saying, can I get a replacement? They can do that right in their My Social Security account. And we have added the option where they can actually pull 5 years, an additional 5 years of 1099s. We also added something called advanced designation. And this is very important because in the event that any of us become unable to manage our own funds in the future, if we become unable, we can actually list who would be good options, 3 choices, who would be good people to help manage our funds if we have a problem and cannot do it. That's so beneficial for Social Security to know. We want to honor your wishes. At the end of the day, we want to pay you always. But if something happens and you become incapacitated or unable to manage your own funds, we want to honor your wishes. Go ahead to the next slide, please. So basic on retirement, you have to work and pay into a Social Security program and earn a minimum of 40 credits or quarters of coverage. That's equivalent to 10 years in your entire lifetime. 10 years in your entire lifetime paid into the Social Security program where taxes are coming out. The easiest way to check is to log into your account, pull it up. It's going to tell you if you don't have enough. It's not going to show dollar figures, and it will also tell you how many credits you have. Know that the most you can earn per year is 4 credits. So whether I earn $6,920 this year, that's 4 credits, or I earn $200,000 this year, it's still 4 credits. So that's the minimum. If you earn more than the minimum, you don't get extra though. So let's say I'm short 6, I can earn 4 this year. I would need to work some next year. The credit amount does change a little bit. The credits never go away. So if you started working when you were 16 and stopped when you were 28, but you had your 10 years, you still would be eligible for retirement once you turn age 62. Go ahead to the next slide, please. So spousal benefits. So you've got your own retirement, you've got your 40 credits. Can we pay somebody else? We might. We pay financially dependent spouses. So if your spouse does not work outside of the home, they can qualify off of your earnings record. It is in addition to what we pay you, so it's extra money. A spouse will never cut into anything that we pay you. You do have to be married long enough, marriage of at least 1 calendar year. Now, what if you and your spouse both work outside of the home? What's going to happen? You're going to get your own Social Security. They're going to get their own Social Security. So we will always pay you off of your own earnings record first when everybody's alive. So I'm alive, my husband's alive, I'm getting my own, he's getting his own. If he made a lot more money than me, I might get some extra off of his earnings record. But you cannot say, I don't want to take my own retirement. I would rather take a husband's benefit or a spousal benefit. That is not an option. You always file off your own work record first, and then we look for any additional dollars off of your husband or wife. Easy way to check is pull up both of your Social Security statements, look at your full retirement age benefit, which is probably age 67. If your spouse's benefit is more than double yours, there's going to be something payable, and vice versa. If they're not, if neither one is more than double, You're getting your own benefit, they're getting their own. Go ahead to the next slide. Marriage of 1 calendar year. What about ex-husbands, ex-wives? So that's a marriage of 10 years. So always remember, marriage of 10 years. To qualify off of your ex, you have to be married at least 10 years. You both need to be at least age 62. Your ex does not need to be receiving. But again, we are going to look at your eligibility off your own earnings record first. And then if there's anything extra payable off of an ex, you will receive that. You have to be currently unmarried to file off of an ex-spouse. So if everybody's alive and I was married for 10 years, but now I'm married to somebody else, I can only file off of myself and the new spouse. If something happens to the new spouse, divorce or death, then Social Security can start looking at the other people that you were married to. Go ahead to the next slide. Anything that we pay you off of any husband or wife does not affect anything that we pay that worker. So what are your options and when should you file with us? You can file online for retirement, spousal retirement, Medicare and disability. You can file by phone for all of our benefits, and you can file in person or by phone for some of our benefits. Now, certain things like survivor benefits, widows, widowers, you have to file those by telephone or in person at this time. There is not an allowance for online. We're always hoping that someday that will be an ability, but so far not the case. When should you reach out? 4 months before you want something and it is realistic. So if I am thinking September of 2024 is when I'm going to file, I should be reaching out to Social Security May 1st or in the month of May. You can reach out by our 800 number from 8 a.m. to 7 p.m. Monday through Friday, or you can reach out to your local office direct. By putting in that link, you will put in your zip code. It will pull up your closest office to you that services you. The offices are available to answer the lines from 9 a.m. to 4 p.m. Monday through Friday. Or you can visit your local office 9 a.m. to 4 p.m. Monday through Friday. Online, about 20 hours a day. The system does go down for routine maintenance from 1 a.m. to 5 a.m. Go ahead to the next slide, please. All right, so we've got survivor benefits. What about death benefits? This is where you have a choice at Social Security. So if you happen to be a widow or a widower, and for that, the marriage only needs to last 9 months unless it was an accidental death. Accidental death could be as little as 1 day. But if you're a widow or a widower, you could say, I want that benefit first, and I will delay my own retirement up until the age of 70. The advantage of doing that is your own benefit will actually be 24% more than you would have received at your full retirement age. So you do significantly receive more money the longer you wait on your own retirement, whereas your survivor benefits are capped when you are your full retirement age. So if my full retirement age is 67, and it is, and I happen to be a widow, I might start my widow's benefits at 67, wait for my own until age 70, and move up to that bigger bump. We will pull the earnings records for you, and you make the decision, but that's the one where you can choose. If there's a death involved, if both spouses are alive, I'm alive, my husband's alive, I have to take my own first and then look at anything additional. And at this time, I'm going to turn it over to Takia. I thank you for your time with me. I wish I could stay longer. Unfortunately, I have to head to a funeral. So thank you so much. And I hope you all have a wonderful day. Thank you.
Thank you so much, Erin, for that great transition. As we move forward, if I could have the next slide, please. So as Aaron was explaining with survivor benefits, when an individual passes away, their surviving spouse may be eligible at their full retirement age to receive 100% of that deceased worker's unreduced benefit amount. We always work with that unreduced benefit amount as if someone was filing at their full retirement age. There is a reduction if that survivor takes that benefit early. So they can take it as early as age 60, but by doing so, it would reduce that survivor benefit to 71.5% of that worker's unreduced benefit amount. There is an exception to survivor benefits if that individual, if the surviving spouse is receiving a pension from a job or organization where they were not paying into Social Security, they will be subject to something that we call the government pension offset or the windfall elimination provision. So that is one of the exceptions to the survivor benefits. So if that survivor is receiving that private pension from an entity that they did not pay Social Security taxes in, it would then be reduced or non-existent in some cases. Next slide. Individuals can also work while they are receiving their Social Security retirement benefits. If that individual is under their full retirement age, so anywhere between, even if it is for widows, so if they start at 60 or at 62, up until that full retirement age, individuals can work and earn up to $22,320 without it affecting their Social Security payment. If that individual goes over that amount, every $2 they go over, Social Security wants $1 back. And then the year that that individual reaches their full retirement age, that amount increases, and they can now earn up to $59,520 for that year up until the month before their full retirement age. So that works really great for someone who's born in May, like myself, because I will be able to work and earn from January 1st until April 30th. I can make that $59,520 without it affecting my Social Security payment. And then that month that I'm going to reach full retirement age, then that lid is blown off and you can work and earn as much as you like. It does not affect that Social Security payment. Next slide. Now, we do have two different disability benefit programs. The first disability program that we have is the Social Security Disability Insurance Program, or SSDI. And the second program that we have is Supplemental Security Income, which is SSI. They are two they are two completely different programs, as one is based on your work earnings, and the other is based on need. So with Social Security disability, we do have a different definition of disability than other agencies may have. And for us, an individual must be disabled and unable to work for 12 months or longer, or that disability will result in their death. And they have to be able, or if they are working, they cannot be earning what we call a substantial gainful activity limit, which is $1,550 for 2024, and that's a monthly gross amount. So even if an individual does have a disabling condition that does affect their work, if they are able to work and earn more than that substantial gainful activity amount, then we cannot consider them disabled and unable to work. We always tell individuals to file as soon as you become disabled, again, unless you're working, and then we want you to file when you stop working or earning under that substantial gainful activity amount. For individuals to file for their disability benefits, we tell everyone that you can actually go directly to our website and file for disability benefits online. We find that when an individual does their application online, they put more information in about their conditions and how it affects their daily lives than when they are actually talking to an agent and having them input that information for them. Again, with disability or SSDI, individuals that qualify for that are individuals that have worked and paid into the Social Security disability insurance system. With SSI, it is a needs-based program, and it is for individuals who are 65 or older who may not have worked and paid into the Social Security system, or individuals of any age if they are disabled and unable to work and they meet those income and resource limits. Next slide. Oh, yeah, it's so exciting. It's Medicare. Everybody's excited about Medicare, right? No, no one's ever excited about Medicare. I am hoping to simplify your Medicare questions today. So very basic, Medicare does have 4 parts. So we start with Medicare A, which is normally just hospitalization, and individuals normally do not pay a premium for Part A, as that is what your Medicare taxes are going in for. Then we have Part B. Part B is your regular health insurance. That is the one that comes with that premium cost, and it also comes with penalties if an individual does not enroll during the right time. Then you have Medicare C, which is a supplemental plan that you would choose on your own. So Social Security representatives cannot assist in helping you choose that plan. We do not enroll in that plan. They are private plans. And again, you would have to choose and enroll in that plan yourself. Then we have Medicare Part D, which is easy to remember because that is D for drugs. And that again is a separate plan, just like that Part C, where you will be choosing it on your own. Sometimes you are able to actually choose a Part C plan that would include prescriptions as well, so you don't need a separate Part D plan. They would actually just lump all of your parts together. So you have to have A and B in order to get a C or D. So they would then just take your original Medicare or Parts A and B, squish them together with that Advantage plan, and now you have a full supplemental plan as well as that original Medicare. Also under Medicare, we have enrollment periods. And there are 3 enrollment periods that we offer. And when we say enrollment, this is when you reach 65 and you need to enroll in Medicare. If you have not already signed up for your retirement benefits, you will have to enroll in Medicare at 65, unless some exceptions apply to you. So the first enrollment period we have is what we call the initial enrollment period. And that starts 3 months before your 65th birthday, the month of your birthday, and then ends 3 months after that birthday. So you do get kind of a 7-month window. So for myself, I always think of my birthday is in May. So my initial enrollment period starts February, March, April, the month of my birth, which is May, and then June, July, August. So you have that 7-month window to file for Medicare, and this is Part B, and that's with no penalty. And that is if you need to file for that Medicare at 65. If you are still working and you are covered under your current employer's group health plan, or your spouse is still working and you are covered under your spouse's current employer group health plan, you do not have to take the Medicare at age 65. You can wait. And what you will be waiting for and enrolling in is a special enrollment period. Under that special enrollment period, it's for individuals who were still working and covered under their current employer's health plan. And they would then be able to file for that Medicare Part B with no penalty 8 months from the time that they stop working, or if that insurance status is based on a spouse's work, then it would be 8 months from the time that spouse stopped working. Okay? And that is how you beat that penalty phase under Part B. I always hear people say, well, Takia, what do you do at 65? Because I heard I had to contact you guys and register and say I'm still working and I don't want Medicare. Well, yes, that's great. And we are very excited that you do not need that Medicare just yet. But by enrolling in Part A only, which is normally what happens once a person contacts us and says that they wanted to register for Medicare, that is fine if you are not also enrolled in a health savings account, because you cannot do those premiums for the health savings account while you are enrolled in Medicare. So you cannot contribute to that HSA while you are enrolled in Medicare, even though there's no premium for Part A. And that your own employment sponsored health insurance would still be primary. That Part A would still be secondary. So I do urge individuals that if you do not need the Medicare, you do not have to enroll in Part A once you're 65. If you are waiting on that retirement and then you'll lose that employer-sponsored health care, then you can enroll in both Parts A and B at the same time. Okay, next slide. Oh, now see, this is nice when I have someone else's presentation. So this is the end of the presentation, and we will take any questions that you may have. I'm not sure if I saw anything in the chat. Let me check.
Question. Can you hear me?
Yes, I can.
Plus, okay, I designate somebody as my advanced payee or representative for the Social Security. Do they become automatically in case of my incapacitation?
They would be
Or
your
are they
representative
financial
payee.
accounts?
Oh, I'm sorry. Say that one more time.
No, I assign somebody as the financial representative for Social Security. Can they handle the rest of the account for which I haven't designated anybody? For the rest of my assets, you know?
No, the advanced designation of payee is only for Social Security. So it would only be there, again, if you become incapacitated and unable to handle your Social Security business, that advanced designation of payee would then kick in, but it would only be for Social Security. You would have to get a power of attorney or a maybe guardianship or conservatorship.
Okay, you're on mute.
Okay.
Yeah. Can I go? Yeah, this is Vijay. The Medicare Part D, they pay any drug coverage, completely my supplement has to pay.
You said with the Medicare Part B?
Part D, for the drugs, for the medications, did they pay something or completely my supplement has to pay?
There are different fees depending on the plan that you would choose. And I do not believe that can be withheld, the C and D, from your Social Security payments, but I am not sure. We would have to check on that and get back. But I do know that we do withhold for the Part for Part B, as well as any increases on that premiums in case it was a penalty or an income-related adjustment.
They can do for Part D.
You said they can do it for Part D as well?
Yes.
Thank you. And I do have a question in the chat that says, can you explain the difference between A, B, and C coverage? And I can. Part A is for hospitalization. So if you were to be admitted to a hospital and stay longer than, I believe it is overnight, then that is when Medicare Part A would kick in and pay for that hospitalization stay. Then you have Part B, as in boy, and Part B is like your regular medical insurance. So that's like your HAP, your HAP, your Blue Cross Blue Shield. It's like that type of insurance plan. And Part B does only cover 80% of any covered services. And those covered services you will be able to find on Medicare.gov. It does go over what Part B fully covers in that. But then that's where you have Part C, which is a supplement. And normally an individual would get that supplement to pay for that gap in between what Part B pays for and what you would have to pay out of pocket. So those are the differences in A, B, and C. Again, C is a plan that you would choose on your own as a supplement to parts A and B. The next question in the chat is, does Medicare cover medical payments for U.S. citizens during their visit outside of the U.S.? And no, Medicare does not have an international coverage. That would be something that you would want to discuss with your insurance provider that you're choosing with that Part C.
I'm not sure that's correct. I think it covers Canada and Mexico in case of emergency.
And also Puerto Rico.
Puerto Rico is not considered a foreign country.
That and also.
And I'm, again, not sure if it's emergency services. I always tell everyone we are the administrators of Medicare A and B. So we do not know everything that Medicare covers because Medicare is its own agency. So any coverage questions, I would direct you to Medicare.gov and they can assist with that information, or you can call them at 1-800-Medicare. That is their 800 number, and they do normally have agents 24/7, I believe, unless they've changed in the last couple of years on that time difference, but you used to be able to reach them 24/7. What happens to Social Security benefits if anyone retires earlier than their retirement age? Well, with Social Security benefits, you cannot take those benefits earlier than age 62. So with Social Security, you could retire. My plan is to retire before age 50, way before I'm going to be eligible for retirement at 62. But what would happen is my benefits would just kind of sit in the trust fund and wait for me to reach that age where I could file at 62. Again, individuals cannot file on their own retirement record earlier than age 62. So those benefits would just be waiting for you if you were to retire earlier than that. The next question in the chat is, if I choose a plan from one provider for C or D, can I later switch to a different plan from a different provider? Yes, you can, but you would have to wait for the open enrollment season for that Medicare switch. And next question says, what is the benefit of taking Social Security at 70 versus 66, or that full retirement age? And the benefit of waiting until age 70 is that you will get delayed retirement credits. So for each year that you delay receiving that retirement payment from us, you will get an extra 8% per year added onto that Social Security monthly retirement payment. So you have the ability, if your full retirement age is 66 or 67, in most cases now, what you would end up doing is earning an additional 24 to 32% in that Social Security payment. And the next questions, one is, are there any changes to the Medicare copay rules? And I'm not sure about copays. Again, any of the payments and things of that nature with Medicare do go through them directly. I do know that the monthly premium for Part B is $174.70 for 2024. So it is, again, $174 for this year, and that is monthly, and each individual pays that premium. It is not a family plan. It is not like a spousal plan, but each individual would have to pay that premium of $174. The second question states why Medicare Advantage is there and it is not being recommended for most folks. And again, with Medicare Advantage, And those supplemental plans, we cannot, as Social Security agents, suggest or recommend any types of those plans because we don't know, one, we don't know what those plans cover, as those are private insurance plans, and we're not sure what type of insurance coverage you would need as well for us to be able to kind of counsel and recommend what Advantage plan is best for you. The best places I know to go to are the area agencies on aging. Or I know in Ohio, I believe it's the OSHIPs, where they are able to kind of assist and help you choose what plan works best for you. Medicare supplement covers travel outside of the US, but not in the VA. And again, not sure what is covered by those private plans, as those are private plans. And whatever that
Massachusetts has
coverage
two
is.
plans.
I'm sorry.
Massachusetts supplement has got two plans, Tufts and Blue Cross Blue Shield. You can select which covers the travel outside too.
Right. And again, with that coverage outside, those are supplemental plans where, again, the Social Security reps do not assist with choosing those plans because everyone's insurance needs are different. So you would have to look into those plans and see which one works best for you. It says, will my benefits get reduced if I stop working before the retirement age? No, your benefit amount would not be reduced unless you're taking that benefit early. So if you're enrolling in your Social Security retirement to get that monthly check earlier than your full retirement age, then those benefits would be reduced by how many months you are filing early. If you stop working and you're just going to let that benefit sit and continue to grow, it would just be at that amount at whatever that year was that you stopped working. And you normally can see what that estimate is if you are having that My Social Security account and you're able to go on and check out your estimates for your retirement at those different stages. Next question says, is there a plan to move the Social Security age up by Congress from 62 to higher and full Social Security from 67 to higher? No, we have not heard of any plans or any actions taken by Congress to change the retirement age, the early state or even the full retirement age. So we have not heard anything different. And normally if you do want to get those updates on the changes that have taken place, you can enroll in our My Social Security newsletter or our blog or vlog online, and you would actually get those updates as soon as they are distributed to the public. There is a clarification about Medicare in Canada and Mexico. Just to let everyone know, Medicare will not cover care outside of the US in most cases. Many Medicare supplement, Medigap plans, and Medicare Advantage C plans will cover emergency care outside of the US. So just to let you guys know, and again, any of those plans you want to look into to see which coverage is perfect for you. It says, what is the reduction percentage? Example, instead of waiting 67, if you started at 65, and it is probably, it's anywhere between, I believe, 7 to 8% per year. So if you start at 65, you'd be losing about 14 to 16% of that monthly benefit. It is very easy to go online and play with those estimators. We have online calculators where you can actually log in with your information and see how much it would be at 65, at 66, at 67, just to see exactly how much that would be for your own account. And the next question says, that I hear correctly that a person cannot have an HSA and Medicare simultaneously? And yes, that is correct. You cannot contribute to that HSA if you have any part of Medicare. So if you are contributing to that HSA currently and you go to sign up for your Medicare Part A only, you will not be able to contribute to the HSA once you are enrolled in any parts of Medicare. If someone is turning 62 and eligible for early Social Security, but decides to hold off until 67, is it possible that the rules can change in between and the ages for Social Security can be changed or increased? Or will the rules be guaranteed under a grandfather clause? I am clear in articulating, yes, you are clear in articulating the question. And again, not sure if there are going to be any changes. We normally know the same time that everyone else does, but normally if the policies or rules do change, they normally may have an addendum or an exception depending on the time period of those rules changing. So a few years ago, we had a rule change that went into effect for deemed filing, and that rule change was 2016. There was kind of a quote unquote grandfather clause for individuals who turned a certain age prior to that January 1st of 2016. So there are certain exceptions to those rules that can be changed, but I can't say that there will be a guarantee for individuals if there are any changes, but there are normally exceptions if there are any policy changes that is done by Congress. The next question states, can a permanent resident holder receive widower benefits if they move out of the U.S.? And that is a maybe, depending on what country that person moves to. We have to have an agreement with that country in order to be able to pay Social Security benefits to individuals outside of the U.S. The next question is, what is the max Social Security one can claim for married couples at full retirement age? And unfortunately, that does vary for each couple. I do know an individual's maximum amount, and that is if they were paying in the maximum amount each year for those Social Security earnings for 35 years. If they were to take that full benefit in 2024, it is estimated at $3,850, so $3,850. Individuals waiting until age 70, I believe it was $4,471 was the max. And again, that's just for an individual, not for a married couple. So because everyone's amounts are different, I could not say this married couple would be eligible for this maximum amount. But again, for an individual, the maximum amount for 2024 and an individual could collect at full retirement age was $3,850. What is the Social Security benefit in case the primary person passes away? And that would be for a survivor benefit. And with survivor, it depends on the age of that survivor. When they are filing for that benefit, they can receive 100% of that deceased spouse's benefit amount if they wait until full retirement age, or if they start at age 60, which is the earliest they could start, then the benefit would be 71.5% of that full benefit of the deceased worker. The next question is, what age does Medicare begin? Same as Social Security. And no, it is not. Medicare does start for individuals enrollment at 65. So that is the earliest for enrollment. In Medicare, normally it's age 65. Then the follow-up question says it's a 3-year gap between getting Social Security benefits versus Medicare. Why is that? And yes, it is a 3-year gap if you choose to get your Social Security benefits early at age 62. So that is why that is. And I'm not sure why Medicare does not start for individuals until 65. That has always been the rule with Medicare. But again, by taking your Social Security early at 62, it is an early benefit. So that is why you would have a 3-year gap in insurance if you decide to take that monthly benefit early. And then I saw some follow-up answers to that. So thanks everyone for answering those questions for me. Then it says if one gets the $38.50 at full retirement, if they wait until 70, does it go up, or is there a limit to max earning? No, once you file for that benefit, you're taking that benefit amount at that time. You're locking in that rate. So if you take that $38.50 at full retirement, it will not jump up to the higher percentage at 70. You will be locking in that rate. And that goes for any time you're filing. If you're filing early, you're going to be locking in that lower rate. And the only time it would go up is if there were cost of living increases, or let's say an individual is still working and one of your new work years changes your calculation previously, then we're able to change that amount. The question is, what is the full retirement age for Social Security? And that is actually dependent on your year you were born. So for individuals born between 1945 and 1954, their full retirement age is 66. If you were born in 1956, it is 66 and 2 months. 55 is 66 and 2 months. 56, 66 and 4 months, and it keeps going up until you reach any individual age who was born 1960 or later, and their full retirement age is 67. Then there is a question is, can one use Obamacare, which is the Affordable Care Act, if one retires at 62 until the Medicare kicks in? And yes, you can have a Affordable Care Act plan if you retire early and you are in need of that insurance. It says Medicare does not cover your spouse. How does that work if the spouse did not work? Yes, Medicare does cover a spouse if that spouse did not work. So they would just actually be filing for benefits through their spouse. So that Medicare would still be based on the spouse's earnings, the same way their monthly benefit would be based on that. But that spouse will have to pay their own premium amount. Each spouse pays their own premium. And again, it would come out of that monthly benefit, and they would be able to file for their own Medicare at that time. But it would not be until they are 65 as well. So I cannot have a younger spouse and cover them under Medicare because they have not worked. They would have to then get a private insurer until they reach Medicare enrollment status. The next one, why does the full retirement age keep changing every few years? It gets pushed out. Well, the full retirement age has not changed. I want to say in the last 10 years, it has been 66 for individuals of that age. It has been for a very long time. And I want to say when it did change is when they started adding on those months. So that is how it keeps, but it doesn't change every few years. It definitely did change, like I said, the last 8 to 10 years. But it was 8 to 10 years ago, not, like last year, and then it turned 8 years before that. The next one says, can you get Medicare if you didn't work but your spouse worked? And I did answer that question previously. Can you please repeat the 1945 full retirement is at? I sure can. So if you were born from 1945 to 1954, full retirement age is 66. And then we start moving up and adding on a couple of months for each year. So individuals born in 55, their full retirement age is 66 and 2 months. 1956 is 66 and 4 months. 57, 66 And 6 months, 58, 66 and 8 months. 59 is 66 and 10 months. And then if you were born 1960 and later, then full retirement age is 67. And last question, can a divorced widow receive Medicare benefits if she didn't work? And yes, it would still be based on that ex-spouse's work. So the same way that they could receive that monthly benefit, then they would be able to receive the Medicare as well. And that was actually like my last question in the chat. So thank you all so much. And I will turn it back over.
Yep, thank you very much, Takaya, and your colleague, Erin Thompson, for presenting this. And thanks for taking all the questions, Takaya, and answering them. And thanks to Chinmaya Mission for organizing this for all the community folks. Good morning, folks. Welcome again for the second session. I think Takaya, the last person from Social Security, mentioned about ownership. Here we have David Painter from ownership. He's been the trainer and conducting several workshops on all things and topics around Medicare. And welcome, David. And I hope, Pilasani, we can just start the presentation from David.
Great. Good morning, folks. Let me get my PowerPoint to come back up there. There we go. And if you could just confirm that you are seeing the PowerPoint correctly. Maybe, maybe not.
Yes, yes.
Yes, it looks good. Okay, thank you. All right, so I'm going to dive right in. Some of this stuff is going to be a repeat from what you've heard this morning, but that's probably not a bad idea because you folks had a lot of questions. Again, my name is David Painter. I am with OSHIP, which stands for the Ohio Senior Health Insurance Information Program. There is a SHIP program in all 50 states and 4 U.S. territories. They're not all called SHIP. Some states have different names for them, but they're all part of the state program. It's a federally funded program to help folks provide, as you can see there, Medicare information, Medicare assistance. All 50 states have one, 4 U.S. territories. About 2/3 of the SHIP programs are run through the Department of Aging, that state Department of Aging, and about 1/3 are run through their state's Department of Insurance. Here in Ohio, we're run through the Department of Insurance. But you see there, we provide free, unbiased, objective Medicare information and counseling services. The hotline I got down there is actually specific to Ohio. If you are looking for your own state's SHIP hotline, of course, it is available online, but you could even call us and say, hey, I'm in Michigan. I want to know the Michigan number, and we'll be happy to look it up for you. Diving right in, because I don't want to waste too much of your folks' time this morning. So what is Medicare? Now, Takaya did a wonderful job sort of setting the groundwork for this. So as I said, some of it will be somewhat reviewed. We're going to get a little more in depth, though. So federal health insurance administered by the Centers for Medicare and Medicaid Services, which they've shortened to CMS. I know there's 2 M's in there in CMS, but whenever you hear CMS, just think Medicaid. So 65 and older, we covered that one. Any age and disabled. Now here we're talking about folks who have been deemed disabled either by the Social Security Administration or the Railroad Retirement Board, if it happened to be someone who worked for the railroad. After 2 years of being disabled, meaning 24 months of disability payments, you are then enrolled in Medicare A and B regardless of your age, as long as you're 18. And any age and diagnosed with end-stage renal disease, now that is end-stage kidney failure, or ALS, better known as Lou Gehrig's disease, right? But by far, the majority of the folks on Medicare, better than 85% of the folks on Medicare, because they reached age 65 or older. And it's a nice flat number. It's not an early come in at 62 and then it's a nice flat number. It's never changed, actually. That's one of the questions we had earlier is why is there different ages for Medicare and Social Security? Because Social Security has changed over the year. Medicare has not.
David, sorry to disturb you, but can you please switch to presentation mode and also switch screens? The slides are...
Okay, let me drop back because I was in presentation mode. Interesting. So what you're seeing is still that, are you seeing the what is Medicare slide or not?
Now we are, but it's still, we can still see your slides on the left. If you're in presentation mode, we'll just see your presentation.
Okay, because that's what I was seeing was presentation mode. How about now? Is it in presentation mode?
Not really, but we are seeing.
You can switch it yourself, the owner, whoever is talking, you need to switch it on the, it's not unless he spotlighted, you're not going to see it. So you can go to view options and go to whatever.
About what he's presenting.
Yes, because I'm seeing it in, I'm presenting it in presentation mode, but you're not seeing it in presentation mode. That's why I'm getting the confusion there.
Yeah, you need to click on that little icon at the bottom next to the book.
Correct.
I'm not sure what's going on, but that's okay. As long as the slides move, it's fine. We were stuck on.
Yeah, no, there's a view options on the top, or wherever it appears, if you click on it, you'll be able to zoom it to your heart's content, each of the viewers.
Okay, because I am seeing it in presentation, but that's why I'm a little confused.
You're good, Mr. Painter. Please continue.
I am. Okay, thank you. All right. So, and when I advance slides, is it advancing? Because now I should say applying for Medicare at the top.
No, it isn't. It's not advancing.
I'm sorry?
It's still in what is Medicare?
Huh. So what are we doing different here? How about now? Now are you seeing applying for Medicare?
Yes.
Yes. All right. Okay, we're just going to go with it. We're just going to go with it as is, I suppose. So applying for Medicare, again, Takeya covered some of this. If you're already getting Social Security benefits prior to turning 65, it's going to be an automatic enrollment. The packet with the cards and all that would just show up in the mail. You're already signed up. That's when I started this job, that was the majority of folks. That's how they, it was an automatic enrollment. That has almost completely flipped now. A lot of that having to do with Social Security. A lot of folks are not retired at 65, still working, or they have a spouse that's still working, something like that. And if that's the case, if I'm still employed or I haven't started my Social Security, but I want my Medicare to start, there's that 7-month initial enrollment period. The 3 months before the month you turn 65, the month you turn 65, the 3 months after. We always strongly recommend the 3 months before. If I was turning 65 this month, let's say today was my birthday and I needed my Medicare benefits to be in place today, I would have wanted to sign up in the 3 months before. If I had signed up in March, my Medicare benefits would have started April 1st, even though I wasn't quite 65 yet. There is this 7-month period, though. If you, for whatever reason, you want to delay that, you can absolutely delay that. Okay, so moving on to the next slide here. Applying for Medicare. It is done through Social Security. The link, the easiest way to do it, ssa.gov. I know Aaron encouraged creating a mysocialsecurity.gov account. I would encourage that as well. It makes it much easier to do a lot of things online, to sign up for Medicare online, to change benefits. It does make it a lot easier if you have that myssa.gov account. If for whatever reason you're not comfortable doing it, I don't want to do it online, I'm not, fluent online, I'd rather go in person, you can still do that. And I know they covered quite a bit of that, but it's in here once again. The national number there for Social Security and the TTY line as well. Now, The main question we get for folks when they are first becoming Medicare eligible is, am I required to sign up for Medicare? Do I have to sign up for Medicare when I first turn 65? I heard there were penalties if I delay. And the answer, I always say this is a good government employee answer. The answer is it depends. It depends. The general answer is yes. Everyone should sign up for Medicare A and B when they first turn 65. However, there's an exception to this rule. And that exception is a big exception. It is if you are covered under your or your spouse's current employer group health plan, you can delay that enrollment into A and B. So I'm going to back that up. Current employer, either I'm still working and covered by my employer, or my wife is still working and I'm covered by my wife's employer. But whoever that insurance coverage is coming from, that person has to still be working. Can't be a retirement plan or anything like that. Whoever my insurance is from, that person is actively employed. It also has to be a group plan offered by the employer. So if you're someone, for example, who, you're self-employed and maybe you have a private insurance plan, or you have a plan through the healthcare marketplace, those aren't going to count for Medicare. Those folks would still be expected to sign up for Medicare A and B. Generally, you're going to save money doing that anyway. But if you are covered under a current employer's group health plan, you can delay that enrollment in Medicare for as long as that's the case. I have a friend that I do some of these programs with. He's up in Toledo, actually where Aaron is from up there. He did not retire and start Medicare until he was 93 years old because he was currently employed as a college professor. He was employed that entire time, and him and his wife did not start Medicare until 93. I'm not recommending to you to work until you're 93, but in his case, that's the way he did it. COBRA is not considered a group healthcare coverage. What is COBRA? When you leave your employer, they're going to offer you the opportunity to continue your coverage for a period of months. Whatever insurance coverage you had while you worked, for a period of months, sometimes it can be as long as 18 months, you can be on the same coverage. Generally, you're paying the full amount for it, though. If you have coverage through an employer right now, you pay a premium out of your paycheck, and the employer pays the rest of the premium. COBRA, you'd be paying the full amount, and it's generally very expensive. I talked to someone just a few months ago on COBRA, and I think they were paying like $800 a month just for themselves. It's also not going to count for Medicare. If I'm on COBRA coverage, I still need to pick up Medicare A and B. Why? Because it's not a current employer coverage. By definition, if I have COBRA, I don't work there anymore. Therefore, I don't have a current employer coverage. So let's say you're still working, or you have a spouse that's still working, and you delay signing up for A and B. I'm not gonna sign up when I turn 65. I'm gonna wait until that other coverage ends. So when do I sign up for A and B? Anytime you're still covered under that group health plan. Okay, you can sign up at any point. Once that has ended, you have up to 8 months that you can sign up for Medicare A and B. After the employment ends or the coverage ends, whichever one happens first. Most folks are not going to do this, though, right? They're going to say, hey, if I'm retiring, April 30th, I want my Medicare to start May 1st because I don't want to have any sort of gap in coverage. But if for whatever reason you have some other coverage or something like that, you have up to 8 months to do it without getting any sort of penalties. All right, moving on. Let's get into the first piece of this puzzle, the part A, or the option 1, the option 2 we were looking at. The option 1, option 2 we were looking at. Here is the first piece of option 1, Medicare A and B. The red, white, and blue card. This is the only part of Medicare that comes directly from the government. This is the Medicare Part A and Part B, the only part of Medicare that's going to come directly from the federal government. Everything else has some sort of private component to it. So Part A, you can see there the card says hospital, Part A in parentheses. I always say think about your Part A as inpatient care. So inpatient in the hospital. Inpatient in a skilled nursing facility. Now, this means like a rehab situation sometimes follows a hospital stay. Inpatient in, home health care. Now, in the case for Medicare, for home health care, it has to be skilled care. So it's going to be part-time nursing, physical therapy, occupational therapy, something along those lines. And of course, hospice care. Hospice is end-of-life care for folks who are terminally ill. Medicare Part A is covering that. Jump over to the other side here. Medicare Part B, your medical coverage. If you want to think of Part A as inpatient, think about Part B as outpatient coverage. All right. First thing up there, outpatient services. This is anything you were doing at the hospital as an outpatient. It's quite a bit of stuff these days, right? Quite a lot of things we do as an outpatient at the hospital. Everything from the emergency room to outpatient surgeries to tests to sometimes our doctors are just located in the hospital, covered under Part B. Doctors and providers are covered under Part B. So this is your doctor's office visits. The reason I put providers on there is it's not limited to doctors. That's also going to include, physician's assistants and nurse practitioners and all that good stuff that we sometimes get to see. Preventative benefits we're going to touch on here on the next slide. In durable medical equipment. Durable medical equipment is things like oxygen supplies, diabetic testing supplies, walkers, wheelchairs, specialty beds, things like that we sometimes need to keep us going, is all covered under Part B. B as in boy. The two little bullet points I do want to hit on these. The first one we're going to cover quite a bit in depth, that Medicare is not going to cover 100% of health costs. We're going to sort of talk about how we can fill that in. The second one, I knew there were some questions about it. Medicare does not cover non-medically necessary services, well, that's a given, or care outside of the United States in most cases. That was one of the things that I know I commented on in the chat earlier. Medicare is federal health insurance. It works while your body is in the United States. Some of the things we're going to be looking at here in a few minutes, the Medicare supplements, and then when we get into Part C, the Medicare Advantage, a lot of those plans will cover you outside of the United States, but typically Medicare is not going to cover you outside of the United States. You have to have some other sort of coverage to cover that. And of course, we can get into that in a little more detail as we go. Preventative benefits. So this is just still part of Medicare Part B, the outpatient stuff. Lots of different screenings, tests, procedures. Most of these are things that Medicare is covering at 100%. So you see a lot of vaccinations up there, right? Flu, pneumonia, even hepatitis B, the COVID-19 vaccine, couple different types of wellness checks. They show diabetes testing supplies, but there's actually a complete list of different screenings, different types of cancer screenings, cardiovascular screenings, diabetes screenings, all the stuff that Medicare does cover at 100% as part of the preventative benefits. You see there is a complete list there at medicare.gov. Or once someone in your home is on Medicare, every year you will get a handbook from the federal government called Medicare and You. It's not a book that I would recommend sitting down and trying to study and learn from because it's not written in a very user-friendly way. It is a good reference book. If you look at it and say, hey, how often can I get a screening for diabetes? You can look that up in the book and it'll say, every 6 months you can get screened for diabetes. It's good for that. It's not really something you're going to want to read too much. Skip one here. Let's get into the 2024 amounts. I did skip one slide on there. There we go. So in brief, I just want to talk about, what Medicare covers, what it costs, and that's kind of what this slide gets into. Part A, I think Social Security covered this very well. For most folks, they have earned their Part A premium free. That is better than 99% of us have earned a Part A premium free. How did that happen? Well, either you worked and paid your Medicare taxes for a minimum of 10 years, or you had a spouse who worked and paid Medicare taxes for a minimum of 10 years. So, and in my case, of course, I've worked more than 10 years. I'm covered, my Part A premium free for life, but also my wife would be covered even if she did not work based on my work record as well. Then we start seeing these big deductibles. Now, this is if I just have original Medicare. What we're going to get into here in a couple minutes, we're going to start talking about these other pieces, talking about secondary insurance. And here in a few minutes, we'll get into the Medicare Advantage. But I'm thinking if I just have original Medicare, I just have A and B, that's where these big deductibles come in. Admitted as an inpatient into the hospital, that $1,632. would cover you up to 60 days in the hospital. You see, as you keep going down, if you're there longer than 60 days, starting day 61, you'll get a daily copay every day of $408 a day, day 61 through 90. Day 91, that doubles to $816. In the real world, however, not many people are in the hospital 60 days, right? You're in the hospital a few days, maybe a few days. And if they're not able to dismiss you home from the hospital, that's where the skilled nursing would come in. Meaning, you're in the hospital says we're going to discharge you, but you're going to go to a rehab for a period of weeks or months until you are able to go back home. You can see with original Medicare, the first 20 days, there's no copayment for the skilled nursing. And then starting days 21 through 100, you'd have a daily copay of $204 a day. There's a very brief Part A. Jump over to Part B. Now, I said most folks have earned their Part A premium free, meaning they're not paying a monthly premium. Most folks do pay a monthly premium for Part B. This year, 2024, that monthly premium is $174.70. Most folks who do receive Social Security and Medicare have this deducted out of their Social Security before they ever get paid. As a matter of fact, you actually would have to let Social Security know if you didn't want them to do that. Meaning, once I've taken Social Security, they're going to automatically deduct my Part B deductible once I'm on Medicare, unless I tell them not to. So you might speak to older friends and relatives who are on Medicare who say, I don't think I pay that. They probably do. They just don't see it because it comes out of their Social Security before they get paid. So $174.70 a month. There's a one-time a year annual deductible. This year it's $240. Now keep in mind, this is for the outpatient stuff. Outpatient at the hospital, doctor's appointments and all that good stuff. So $240 once you've met that one time in the year. Once you've met that in the year, your Part B is an 80-20, meaning Medicare is going to pay 80% of your medical expenses, and you're going to be left with that remaining 20%. Little thing in red says, hey, you can also create a mymedicare.gov account. I always tell folks it's one more username and password because we don't have enough of those in our lives. But it is a nice account because you can see what's been billed to Medicare pretty quickly. You can also check on, hey, are there any preventative benefits I'm eligible for, things like that. It is a nice account to have. Shifting gears a little bit, let's talk about the Medicare savings programs. Now, these are run individually by each state. Okay, so far we've talked about Medicare, which is federal. Each state runs its own Medicare savings programs, but they're all pretty much the same thing. These are for folks with lower incomes, lower resources, and we'll talk about what that means here in a second. And these are ones you'd apply for at your state Job and Family Services, and they would reimburse that Part B premium. So that $174.70 would still be coming out of your Social Security or your bank account, however you have it set up. The federal government would still take that out. The state would put it back. To me, the individual, I just still have that money. I don't care about all the stuff that went on behind the scenes. I'm just happy that I still have my $174.70, correct? Sorry about that. My email keeps coming up, and I apologize for that. Still have that. So how do I qualify for this? You have to be under these income and resource guidelines here. Now, I'm going to just do the single person just in the interest of time this morning. So my monthly income would have to be below $1,661 a month. What counts as income? Well, your Social Security is going to be income. Any sort of pension, 401k monthly disbursement, any monthly payment I get there. If you're still working, any wages that you're making from working, all of that gross before any taxes or anything comes out would have to be less than $1,661 a month, and you'd have to have resources of less than $9,430. What are resources? Easiest way to think of resources is your cash and your money in the bank, meaning your checking, your savings, and however you have your money invested. What doesn't count as a resource is your home. As long as you or your spouse live in your home, it's not going to count as a resource. If you have property other than your home, well, now that's going to count as a resource. If if you have, your vehicle's not going to count as a resource. So it's really just the cash that you have in the bank invested that they can easily see. If you're below both of those, below the 1,661 in monthly income and the 9,430, and of course the married amounts are below that, this is something worth applying for. It's a fairly easy thing to do. It's an application. You can do it actually on your state's Medicaid website, or you could go to Job and Family and get a paper application. It's a pretty straightforward process, and it can save people a lot of money. So I always tell folks, this might not be you. You may have already checked out and said, well, that doesn't apply to me. Always take a few minutes and think, who do I know on Medicare who might qualify for this and could possibly save quite a bit of money? All right, so that gets us through original. That's what's going to take the longest this morning, all right? That's what original Medicare A and B. For some people, that's it. I'm just going to go with original. I'm not going to have any other pieces. Other folks say, nope, I want something to pay what Medicare didn't. I want something to fill in those deductibles and that 20%. A few different ways to do it. First one there, group health insurance. That's if you are fortunate enough that you worked for an employer or a union that continues to offer you insurance benefits once you've retired and you're on Medicare. There's not a ton of those out there anymore, unfortunately, but there are still some. There are still some unions and some companies that still offer that to folks, and it's generally a really good benefit. Medicaid is another way to do that. Medicaid, not to be confused with Medicare. The important thing to remember to keep them separate, look at the last three letters of Medicaid, AID. Medicaid is, again, for folks limited income, limited resources. There are a lot of folks who have both. They have Medicare as a primary insurance, Medicaid coming as a secondary insurance. Again, you have to qualify for Medicaid through your state. The third one's where we're going to spend a few minutes. Medicare supplemental insurance, sometimes called Medigap, sometimes called a MedSup. So Medicare supplement, Medigap are literally the exact same things. What are they? Private insurance policies offered by private companies. So it's not the government in any way. Private insurance companies offering private policies. If you purchase one, you're paying them a premium every month. In exchange for your premium, they're coming in after Medicare pays its portion and picking up most, if not everything, Medicare did not. These are not cheap plans. They're not inexpensive. Pardon me, excuse me. Even for someone who is new to Medicare at 65, signing up for the first time, I wouldn't anticipate getting a supplement for less than $100 a month. And that's going to be on top of the $174.70 we already talked about. They're not inexpensive. So why do people like them? Well, a couple big things. For one thing, there's no network. I can use any provider, any hospital that accepts Medicare, and that's going to be anywhere in the United States. There is a subset called Medicare Select. We don't see too many of these in Ohio. You might have them more in your state if you're from a neighboring state. The Medicare Select plans are generally less expensive, but they're going to have they might require the use of specific hospitals. There's no annual enrollment for the Medicare supplement because they're 100% private insurance. You can enroll and disenroll at any time during the year, with some exceptions. I'll explain that here in a second. So they pay after original Medicare. So Medicare comes in, pays its portion. The supplement's going to come in and pick up most, if not everything, Medicare did not. Some of these plans are really comprehensive, and they'll pretty much pick up everything Medicare didn't. Even if you did have a major health issue in the year, it's going to pick up everything Medicare did not. Not cheap. We covered that already. They are, however, standardized, meaning companies are selling the same plans. Excuse me, I have a tickle in my throat all of a sudden. They are sold by plan name, A, B, C, D, F, G, K, L, M, and N. Lot to keep track of there. All you got to think of is this. I'm going to take a plan G, right, kind of right there in the middle. A plan G is a plan G, regardless what company I buy it from. It's going to cover the same things at the same rate if it's a plan G. And that's true of each one of them. If I'm buying a plan N, doesn't matter who I purchase that plan in from, it's going to cover the same things the same way. The big difference is going to be what they charge for it. Two different companies, two different plan Ns are going to, it's the same coverage, going to cover all the same things, but they're going to charge me a different monthly premium. Why? Because they're private companies. These companies have to set their own rate and hope to earn your business. So if this is something you're in the market for, or when you're in the market for it, maybe on down the road, it is important to shop around. Don't just go with the first company that sends you a postcard in the mail. You really got to shop around and try to find the best deal out there. There is this guaranteed issue date. Now, what this guaranteed issue is a period of time, even though these are private companies sold by, or private policies sold by private companies, there is a period of time where you can sign up. They have to accept you as a client, no questions asked. For some of us, it only comes up once, and that's this original open enrollment. The first 6 months that we are on Medicare Part B at age 65 or older. Now, why does it say Part B at 65 or older? Both those things have to be true. I have to have started my Part B and at least be 65. So maybe you're one of those folks who says, I'm going to work past 65. I might sign up for my Part A because I already paid for my Part A. I'm going to go ahead and sign up, but I'm going to delay that Part B. I'm not going to sign up for that Part B. I don't want to pay that monthly payment while I'm still working. And you don't retire until you're 66 or 67. Maybe you're waiting for that full Social Security. You still have those 6 months. You can sign up, no questions asked. Any plan that's offered in your state, they have to accept you. They cannot take your health into account. The only other time that's going to come up are these special circumstances where it says typically 63 days after loss of coverage. Easier way to say it, anytime you've lost coverage through no fault of your own. That could be a plan went out of business, a plan left your state, maybe you moved from one state to another. That's generally, you're going to have this nice little window of 63 days where once again, you can sign up, no questions asked. What if you're not in one of these guaranteed issue periods? You can still apply for a Medicare supplement Medigap plan at any time. But if I'm not in one of these guaranteed issue periods, then they will ask health questions. They'll give you, at the very least, give you a health questionnaire at the application. Depending on how you fill it out, they do have the option of saying, no, thanks. We don't want to cover you. You're too sick for us. I always tell folks, think about the big things. Think about, do I have heart issues? Do you have cancer is probably the most common one that's going to, disqualify you. Do I have cancer, kidney disease, lung disease, something like that possibly is going to cost this company money moving forward? That's when they're not interested in me. They're not interested in selling me a new policy if they think I'm going to cost them money. So it is important, again, if this is something you're in the market for, to look at it when you do have this guaranteed issue period. You're going to get the best rates and you're going to get that guaranteed acceptance. Here in Ohio, we can actually help folks compare those plans. I think most of the SHIP programs have that ability now. We were one of the first that had that software, but I think almost every state does have it at this point, where they can kind of look at these plans and help narrow it down for folks. That gets us 2/3 of the way through this option one. Talked about original, talked about secondary. Whether or not you have secondary with original coverage, the other piece that's really important is Medicare Part D. And Part D is prescription drug coverage. Part D, it says, of course, Medicare's prescription drug coverage. Once again, these are private companies, but now they are under contract with Medicare. They're available 2 different ways. Standalone Part D plan, that's what goes to the original Medicare. They're also available as part of the Medicare Advantage plans, the Part C plans we're going to talk about next. Enrollment's the same as signing up for Part B, and everyone with Medicare can sign up for any Part D plan. You can sign up for any Part D plan offered in your state. They're all going to be statewide. There's no health questions or anything like that. And then every year, once you're on Medicare Part, every year you get the opportunity to do it again. October 15th to December 7th. That's the Medicare open enrollment period. For those of you who are not Medicare eligible yet, you will never forget the open enrollment period because you're going to get mail, ads in the mail every single day. You're going to get phone calls. It's going to be on TV, and you're going to be like, I can't wait till this is over. Every year for the rest of your life. October 15th to December 7th, it is the time to look at your drug plan or your Advantage plan to make sure it's still going to be the best one for next year, because they can change from year to year. And this is one of the things that the SHIP program really comes in to help folks with, and this is across the country, to help compare those plans. Just like Social Security, we're not going to tell you exactly what to pick, but we're going to tell you, here's what this one costs and covers versus here's what this one costs and covers. And with the Part D, it's pretty straightforward. It's pretty straightforward as to, hey, this one's less money and does the same thing as the other one. Sign me up. For whatever reason you don't like that plan, change it the following year. You can change it every single year. And this is Ohio specific, just some individual, costs out there. I don't want to dive into that too much because I said it is an Ohio specific thing. Low income subsidy. This I do want to get into, and I'm not sure if Social Security mentioned this one or not. It is a Social Security program. This is more commonly called the extra help with prescription drugs. It is a Social Security program, so it's the same throughout the entire country. Folks can enroll in it. They're picking from the same drug plans that everybody else is, but they're getting it for less money. You can see no monthly premium, no deductibles, and they'll never pay more than $4.50 for a generic and never pay more than $11.20 for a name brand drug. There's the income and resource guidelines, quite a bit higher than the ones we looked at before. So again, if it's not you, if you know someone on Medicare who might qualify for this, send them towards your local SHIP program, and we will help them get enrolled and hopefully save them quite a bit of money. That gets us through option one. We are almost there, guys. When it's a webinar, I always have to say we're not halfway there. We're almost done. Talked about original Medicare, talked about secondary, talked about Part D. A lot of folks go that route. A lot of folks go Medicare Advantage, this option 2. Now, you can see it's sometimes called Part C, and they use those interchangeable. I wish they would decide, are we going to call this a Medicare Advantage plan, or are we going to call this Part C? It would confuse people less if they just come up with a name, but I don't know if they're interested in confusing people less. So what are these? These are, once again, private companies under contract with Medicare. They're all-in-one plans. Hospital, medical, and your prescriptions all wrapped up in one plan. The way I've been describing it to folks is if you are signed up for a Medicare Advantage plan, essentially you have said, while I am on this Medicare Advantage plan, private company under contract with Medicare, while I'm signed up, this is now my insurance. This is my primary insurance. What it costs, what it covers, the doctors and hospitals in my network, that's what I'm going to go with for as long as I have this plan. Moving on. Okay. So it's available. Everyone has A and B. You have to have both A and B because it's going to stand in for your A and B, right? You have to live in that plan service area. For most of the country, maybe all of the country now, which Advantage plans you can sign up for are based on the county that you live in. So if you ever wonder in those commercials where they always say, oh, they looked up my zip code, I just called and they looked up my zip code. That's why they want to look up your zip code. They want to know what county you live in so they can look at what Medicare Advantage plans they might try to sell to you. There's no age or medical restrictions. They are under contract with Medicare, so anyone can sign up for them every single year. And it says an alternative to original Medicare, private companies to replace your original Medicare. The two main types, and this is throughout the country, are the HMO and the PPO. There's a big distinction between the two. The HMO, the Health Maintenance Organization, you have a network of doctors, hospital providers that with the HMO, you have to stick with. Got to stay with your providers with the HMO or you are not covered. The other option, the PPO, is the Preferred Provider Organization. With the PPO, you have a network of doctors, hospitals, providers, and it's going to cost you less money if you always stick with providers in your network. With a PPO, however, you can go outside of that network, see any provider who accepts the plan. You're just going to pay more out of pocket if they're out of your network. So the HMO, you got to stick with the network. PPO, you can go outside of that network, see anyone who accepts the plan. Most of these plans include the Part D, the prescription drug benefit, as part of the Advantage plan. So when you're looking at these plans, not only do I need to look, is my doctor in network? Is my hospital in network? I also need to look, are all of my prescription drugs covered? Is it going to meet my prescription drug needs as well? So enrollees pay the Part B premium and any other applicable costs. Let me explain that real quick. A lot of the ads you'll see for Advantage plans will advertise them as zero premium plans. Hey, our plans are zero premium, $0. How does that work? Well, you're paying a Part B premium to Medicare. Okay, I have Medicare. I'm paying $174.70 for my Part B. If I am enrolled in a Medicare Advantage plan, Medicare is taking most of that $174.70 and sending it on to that Advantage plan. So they're still getting paid. They're still getting paid by me. Just in that case, Medicare is working as the middleman, so to speak. Medicare is the middleman in all of that. The networks vary, of course, from plan by plan. The premiums can vary, and the copays. Now, how these are going to work a little different than original Medicare and a supplement. With an Advantage plan, every time I use it, I'm going to owe a copay. I'll owe a certain copay at my primary doctor. I'll owe a copay at a specialist. I'll owe a copay the first few days I'm in the hospital, and so on. So it's not Medicare paying and then a secondary paying. This is now my insurance. Whenever I use it, I will have a copay. The initial enrollment, the same as signing up for Medicare to begin with. And then once again, every year you have this open enrollment period, October 15th to December 7th. Just like with the Part D, it is important to look at the Advantage plan every year to make sure that it hasn't had too many changes from the year before. Make sure that it's still going to meet all of my needs. Just like with the Part D, this is where your SHIP program in your state can come in and help out with. Take a look at these plans, make sure it's still going to be the right one for you for the following year. There is a little bit of an extra enrollment period for folks on Advantage. It just ended last month. And it's this Medicare Advantage open enrollment period. These are for folks who come January, find themselves on a Medicare Advantage plan, whether it's new, they just signed up for it, or something they've been on for a while, and they no longer want that plan. They have an extra 3 months where they could switch to another Medicare Advantage plan, or they could drop it, go back to original Medicare. That's just a little bit of a, what they call a do-over period, so to speak, just to make sure you're on a plan that's going to work for you for the next year. 5-star plans. Now, and I see my slides a little messed up here, but let's talk about the 5-star plans. There are some Medicare Advantage plans that CMS, Medicare, has rated 5 stars. That's, the highest you can get. It's 1 to 5 stars. If a plan is rated 5 stars, and we only have 2 here in Ohio this year, if they're rated 5 stars, that means you can really sign up for them anytime during the year. Don't have to wait for an open enrollment period. I can enroll at any time I want. My caution with the 5-star plans is it still has to be 5-star specific to you. And what I mean by that is I don't want you to see 5 stars and think, hey, that's a no-brainer. It's 5 stars, the best one out there, sign me up. I still got to make sure my doctor takes it. I got to make sure the hospital that I want to go to is going to take it. If I end up in the hospital, I got to make sure my prescriptions are covered. Still have to do my homework before I sign up for the 5-star plan. It's great that they're rated 5 stars, but it's still, these are such specific plans that it's important to make sure it's still going to work for you. Moving between the options, this is where it can get a little bit tricky. Moving from option 1, original Medicare and a supplement, to option 2, a Medicare Advantage. Anytime there's an open enrollment, the annual open enrollment every year, or when you're new to Medicare, you can always do that. From a supplement, original Medicare and a supplement Medigap to another supplement Medigap, if I'm not in a guaranteed issue period, I can move at any time as long as the new company will accept me. Remember, those are the ones that are private. It's up to the company whether they want to sell me a policy or not. Advantage to Advantage, anytime Medicare open enrollment is open, I can always switch from Advantage to any other Advantage offered in the county I live in. And then Advantage to supplement, the same sort of thing. If I'm not in a guaranteed issue period, I got to, answer those medical questions to see if I can sign up for a new plan. This a lot of information. I'm gonna say it a slightly different way on the next slide. I do think you folks are going to have access to these slides, and I do know this is being recorded. So I'm going to say a slightly different way. So let me jump one more down, and we'll talk about knowing your options. Option 1, option 2. Which is the way I want to go? Let's first talk about what it costs. Original Medicare, $174.70 for your Part B. If you're going with a Medicare Supplement Medigap plan on top of that, it could be another 100 plus beyond that. But let's just do a nice even 100 there. Now we're at $274.70. I still need a Part D plan, which could be another $10, $20, $30, depending on the prescriptions I take. So we got real close. We got to $300 pretty quick there. What am I getting for all that money? Well, a couple big things. Number one, I don't have a network. with the Medicare supplement, I can go to any provider in the United States that accepts Medicare, no questions asked. Most of the supplements will cover you outside of the United States. Most of the Medicare supplement Medigap plans do have what they call foreign travel emergency coverage, which means I'm outside of the country and I need that coverage. Why does it say emergency? And a lot of folks worry about that. And I say, well, for the most part, if you're outside of the country, you're not scheduling your regular doctor's appointments outside of the country, right? It's if you've gotten sick or you've gotten injured or something like that, and that all constitutes an emergency, you know? So in that case, a cold or a flu, it's an emergency because I'm out of the country and I need medical care. So I don't have a network. I'm also not going to have a lot of bills because the Medicare supplement Medigap is going to pick up most, if not everything, Medicare did not. So even if I did have a major health crisis in the last year or during the year, I'm not going to be paying hardly anything out of pocket for that. I had a lady I just spoke to a few weeks back who said, boy, I had my supplement policy for I forget how many years. She said, I never used it. And then one day she passed out, had emergency surgery, woke up in the hospital. The bill was like $50,000 and she paid nothing. She owed zero because Medicare paid its portion. Supplement picked up everything. Medicare did not. And she told me, she goes, I'm never getting rid of this plan now. So that's one way to look at it. Jump over to the Advantage, Medicare Advantage Part C. Still paying your $174.70 for your Part B. And for some of these plans, that's it. $174.70, that includes my drug plan. You know, quite a bit less expensive, you know, half of what the other one is. So what am I giving up? If I'm not paying as much, I'm losing something. Well, for one thing, I do have a network. If I have an HMO, I have a network I have to stick with. If I have a PPO, I don't have to stick with my network, but it's still going to be a lot less expensive if I do. It's gonna be less. So I have a network to think about, and I'm going to have copays. I'm going to have a copay every time I use medical services. Anytime I go to the doctor, the hospital, the pharmacy, whatever it is, I am going to have a little bit of a copay. So I'm not going to pay as much up front, but I have the potential of paying as I go, particularly if I have major medical issues within the year. So it's almost, if I do it in a couple sentences, I say option one, I'm going to pay more money up front. I'm not going to have a network, and I'm not going to pay as much as I go. Option two, Medicare Advantage, I'm going to pay less money up front. I do have a network, and I have the potential to pay more as I go, depending on how the year goes. Real quick about Medicare fraud. There's a whole list of things that insurance agents are not able to do. You see it there. No door-to-door sales, giving out cash gifts exceeding $15. Of course, high-pressure sales tactics, misrepresenting the plan. But there's the big one, representing themselves as Medicare. I'm here to tell you folks today, and please tell everyone, Medicare is not calling them on the telephone. Medicare is not texting them. Medicare is not sending them emails asking for personal information or to click on a link here or there. That's not how Medicare is going to reach out to folks. It's not how Social Security or the IRS is going to reach out to folks. They're going to send you a letter through the Postal Service, through the U.S. mail with instructions to contact them. So please let everyone know, this person who on the other end of the phone who says they're from Medicare are not from Medicare. They're most likely someone trying to steal their identity. So please tell all your folks, don't give your information out to anyone unless you know who you're speaking to. How do you know who you're speaking to? Well, if you called them. If you call Social Security, if you call Medicare, if you call the SHIP program in your state, yeah, you should feel free to, share that information. Obviously, the doctor's office, the hospital, share that information, but don't share it to anyone who contacts you. Senior Medicare Patrol, there is one of these in every state as well. They are a group that just helps folks who have become victims of this fraud kind of try to right the ship a little bit, try to get their stuff back together. But that brings me to the end. We're going to open up. I'm going to take a look at the chat, and we'll see what questions we have. I do one more time want to mention there is a SHIP program in all 50 states. Of course, the number I have up here is Ohio. You can absolutely get in touch with us and say, hey, let me know, the number for, Wyoming, wherever you're at. We'd be happy to look that up for you. Medicare.gov is another way to go. 1-800-Medicare. They're 24 hours, 7 days a week. If you're getting into more in-depth stuff, like looking at the different plans that are available, Part D plans, Advantage, they're going to actually refer you back to your SHIP program in your state anyway. That's what we're funded to do. So they're not going to get real in depth, but they are someone that you can speak to 24 hours a day. And of course, there's the Social Security number as well, which we've seen a lot this morning, right? And they're always there as a great resource as well. And of course, there's the Social Security office somewhere out there in your area. But let me switch this screen back and we'll take a look at the chat here. Maybe. All right. So I got to jump back and see where we left off with Social Security. Please switch screens. Yeah, that was me. Here we go. Can a doctor refuse to accept Medicare? They can, actually. A doctor, not refuse to accept, but a doctor has to actually have a Medicare billing number. Has to have a Medicare billing number and has to agree to be part of the program. A few years back, and by a few years, at this point, it's like 10 or 15 years back, they were saying, oh, all the doctors are going to leave Medicare. It's getting too complicated. And there were some doctors who, said, we're out of here. And then they realized that 80% of their patients were on Medicare and they're back now. So we don't have a whole lot of doctors not accepting Medicare. There are some out there that do not accept Medicare. And it just jumped on me, so I apologize. Keep moving down here. A lot about presentation mode. I apologize. If your employer covers your medical benefits after retirement, how does the Part B premium payment get reimbursed in that case? So let me read that one more time and make sure I read it correctly. If your employer covers your medical benefits after retirement, for example, 25 plus years service with the government, how is the Part B payments going to get reimbursed? Well, it depends on what we mean by the employer coverage. Some employers, and I'll use Ohio as an example, state teachers and school employees here in Ohio, their union offers them insurance coverage after they've retired. Assuming they've had a correct number of years, they're going to have that coverage. They would still have Medicare A and B, however. They're still going to have Medicare A and B, and their retirement insurance is going to supplement the A and B. There's a lot of federal employees, though. So federal meaning I worked for the federal government. They're kind of a unique case because there are a lot of folks who are federal retirees who take their Medicare Part A and then have their FEHB for everything else. Their federal employee health benefits. I should have mentioned what that was before I said it. Federal employee health benefits for everything else. So there are a lot of federal employees who never take that Part B, and it works fine for them. Because things are jumping in here, I apologize. Can you sign up for Part A only and wait to sign up for Part B when you stop working? Absolutely. Absolutely. And that has really kind of become a very commonplace thing these days. I've signed up for Part A because I paid for it. Why not take it, right? Now, I will say while you're working covered under a current employer's coverage, your Part A is not going to do a whole heck of a lot. It's kind of going to sit there in the background. Even if you're hospitalized, it probably won't do very much. But yeah, you can wait. So when do I go to sign up for Part B? I always tell folks that 3 months before is the time to think about it. So if I know I'm retiring, at the end of the year, so I'm going to retire, December 31st is my last day at work. The 3 months before, December, November, October, that's the time to start getting signed back up for things. That way everything's in place. And when you walk out the door at, December 31st, all your stuff's in place to start January 1st. Most doctors do not like to accept Emblem Health as a secondary insurance. I'm not familiar with Emblem Health. That's not something we have here in Ohio. So I'd need to know a little more about it. I'd need to know if it is what type of coverage it is, where it falls on that. If covered by group health insurance and in retirement, do I need to sign up for a Part D? Great question. There are a number of prescription coverages that, number of different types of prescription coverages that do count as a Medicare Part D plan. A lot of the retiree plans do. Most of your, of course, federal retirees do. Veterans benefits, all of that's going to count as a Part D plan. If it's a private employer, or regardless who it is, even if it's the Veterans Administration, they have to every year in writing send you something that says that their Part D benefit is creditable coverage to Medicare. And what that means is that it meets or exceeds Medicare's minimum standards for Part D. They're legally required to provide that to you every year. As long as you have that, then no, you don't need to sign up for Part D. If something changed on down the road and you had to sign up, you wouldn't be penalized because you had Part D that entire time. And again, the next question says the difference between Part C versus Medigap. Again, with Medigap, Medicare supplement, that's the option 1. I have original, I have secondary, a Medigap plan. So in that case, Medicare is going to pay first, then the Medigap's. Medicare is going to pay first, the Medigap supplement plan is going to pay secondary. They're more expensive. I don't have a network, and it's going to pay just about everything. The Part C are the Medicare Advantage plans. That's where if I sign up for the Part C, it is an all-in-one package, and I do have a network to deal with, and I am going to have copays as I use it. Is there an advantage to getting Medicare Advantage versus signing up separately? Really, it's a personal preference. With the Advantage plan, some of them do offer some additional benefits. They'll say, gym memberships and reimbursement for over-the-counter medication and all sorts of good stuff like that. I tell folks that's not how we're going to pick the plan, though. We're first going to make sure that my doctor's in network, my hospital's in network, my prescriptions are covered. Then we'll take a look at all these other things. They're going to advertise all the added-ons, all those added-on bonus things. And what I've taken to telling folks is that's like buying a car based on the radio. Hey, it gets terrible gas mileage and it's going to break down every 5,000 miles, but your music's going to sound great. That's not a car I want, right? I first got to make sure the core medical benefits are going to meet my needs. Then look at all the add-ons. I'll look at the add-ons after that. If I take a Medicare Advantage plan, do I need to pay Medicare Advantage plan and original Medicare too? With the Advantage, you will still be paying your Part B premium. A lot of the Advantage plans will advertise themselves as zero premium. And what they mean by that is they get that Part B premium that you're paying to Medicare, and they accept that as payment in full. So you're paying it to Medicare, Medicare's paying it on to the Advantage plan. So Medicare is just working as a middleman in that situation. There are a lot of companies out there, yes, that will advertise their zero premium plans. Always keep in mind, you're still paying that Part B premium. This year, 2024, $174.70, you're still paying that every month. And if a plan says it's zero premium, what they really mean is they're accepting that Part B as their payment in full. Do we save money by signing up for an Advantage plan? You're going to save money in premium. You're going to save money in monthly premium. Where it could get more expensive is if you do start having a lot of medical issues. I'll give you an example. This is actually from my own life, actually. This last year, my father-in-law had to do chemotherapy. He had to do 35 sessions, so it was 5 days a week, 7 weeks. He had original and a Medicare supplement. He didn't pay anything for any of those chemo sessions, right? 35 sessions, he paid zero out of pocket. But he is paying quite a bit more every month for that coverage. If he had an Advantage plan, he might not have been paying a premium other than his Part B premium, but he would have had a copay every time he got the chemo. So he would have had 35 copayments. So it's possible, depending on you, it's possible that that the Advantage could end up being more expensive if there is a major health crisis like that. All right. Do we save money? Does group health insurance cover outside of the United States? It depends on the group health insurance. Okay. There's some I can speak to. Federal retiree, yep, that's going to cover you outside the United States. TRICARE, retired military, absolutely. But a lot of the group health insurance is private between your employer, your union, and the company. So you'd really have to look at the details. You'd have to get into the details and say, does it cover? There's probably a customer service line. That would be a easiest way to go. Give them a call and say, hey, I'm going to be out of the country for, X number of weeks. Am I covered? Am I covered? That's probably the easiest way to go. And someone says, also, do not go to suspicious websites ever. Yeah, 100%. Keep in mind what we've shared with you today has all been .gov, .gov, SSA.gov for the Social Security Administration, Medicare.gov for Medicare. .gov means it's a government site. If you actually accidentally type in Medicare.com, you're not going to a suspicious site, you're going to a commercial site. And if you put in any information, you're going to start getting phone calls from people selling you stuff. So yes, make sure, keep an eye on those websites, 100%. I found Medicare when I called them very courteous and prompt, same as Social Security. Good to hear. The last time I called 800 Medicare, the woman I spoke to was phenomenal. I haven't always had that experience, but the last time it was wonderful. And again, Part C, Medicare Advantage. If you're signing up for Part C, you're essentially saying, this is a private insurance policy that's going to stand in for my Medicare. You will have a network of doctors and hospitals, and you're going to have a copay every time you use it. So with the Part C, for a lot of folks, it looks more similar to what they had when they worked, meaning I have a PPO now, through my employer. When I go to the doctor, or my wife or kids, go to the doctor, yeah, we pay a copay and the plan picks up the rest. That's kind of maybe closer to what a Part C or Advantage plan looks like. Is there any way to avoid a penalty for not enrolling Medicare when I turned 65? I was out of the country and was in a place where I could not. I did enroll when I was 66 and continue to pay the penalty. Oh, Siva, I wish I had a great answer for you, but my answer is no. Unfortunately not. I've had this happen before. I've had folks who have been in that situation. Hey, I wasn't even in the United States. I couldn't, very well sign up for Medicare from wherever we were. And I wish I could say there was a way to get that penalty wiped out, but I'm afraid there is not. Yeah, I mean, I'm trying to think if there's some Hail Mary I can come up with, and I'm sorry, I don't think there is. More information on Plan N and G. Honestly, Medicare.gov is going to have information on each and every one of the supplement plans, what they cover. There's a real nice chart on Medicare.gov that covers all that. I would be happy with the organizers of this. I will email out some info that will have that chart in it as well to them that they can share with you folks as well. Can I shop around during every enrollment period? You can always shop around for a Medicare supplement at any time, but you're not in a guaranteed issue period, meaning anytime during the year, I can look for a new Plan G. That's what the question specifically asked about. I can look for a new Plan G, but I would have to answer health questions. If I'm going to a new company, I'm going to answer health questions. And that's only true for those Medicare supplement Medigap plans. Everything else is part of Medicare, but these are technically private. And then the last one I have up here is, hey, why is acupuncture not accepted, even though it's very effective? First of all, I agree with you that it's very effective. It works. Why is it not covered yet? Great question. I could ask the same thing about my private insurance I have, or my private insurance I have through work does not cover acupuncture. I think it's one of those things where it's going to take a little while for the government to catch up. It was a very long time before they started covering chiropractic medicine. So I think things like acupuncture and Reiki and things like that, unfortunately, we're going to be a few years behind that stuff coming back up. So I do apologize. Well, I shouldn't apologize. I'm just going to say it's going to be a little while. And then he says when the same person commented, when the FDA is going to accept it as legitimate, and a couple of doctors recommend the same. Absolutely. And it's really going to take the doctors convincing the rule makers in Washington. I mean, I wish I could come up with a better way to say that, but that's the easiest way to do it. What happens after 90 days if you're in a serious condition? Will co-insurance apply all along? So he was thinking about the in the hospital, I assume. We're talking in the hospital. So the first 60 days covered at 100%. Days 61 through 90, you have a daily copay. And then days 91 through 150, you have a daily copay as well. What happens if I'm there longer than that? Generally, the Medicare supplement is going to actually continue. If I have a Medicare supplement Medigap, they generally would cover me 365 days in the year in the hospital. What if I had original Medicare? I would run out of insurance, unfortunately. It's almost never happens, but you're right. It could happen, right? It could happen. In the last 5 years, we've lived through some pretty crazy stuff health-wise in this world. So who knows what could be, waiting down the road. So I wish I had a better answer for that one as well. And I don't see, if I missed one, let me know, but I don't see where I missed one.
Hi, David. This is Ramesh. I had asked that question because not many people understand that or aware of that. Once you exceed that 90 days, if you are hospitalized, say, for a year, what are the things that we should take into account to basically, this could just be bankruptcy for a lot of us,
Sure.
If you really need $400 a day for a year, a lot of money. So is there anything that you count?
Is a crazy amount of money, yes. As I said, if I did have a Medicare supplement, that would cover me 365 days. But again, usually what's going to happen is at some point I'm going to transition from the hospital to a skilled nursing facility. The skilled nursing facility, I would have Medicare coverage for up to 100 days. If I'm there more than 100 days on day 101, which does happen, I've now transitioned to what's called long-term care. And long-term care is no longer Medicare. That is long-term care insurance for folks who have it. Not many do. Self-pay and or Medicaid. So it can happen. Usually it's not the hospital for more than 150 days. Usually at some point they do, even during all the COVID stuff, they were moving people into the skilled nursing. And again, you have 100 days in skilled nursing, but day 101, you've now moved into long-term care and it's not a Medicare issue anymore. Now it's a self-pay. And once you've self-paid and run out of money, now it's Medicaid. And for folks who are in long-term care, and long-term care, really an easier way to say it, nursing homes. Okay, folks who are in nursing care, Medicaid, not Medicare, but Medicaid is the number one payer for folks who are in long-term nursing care here in the United States because it's so expensive. It's so expensive. Folks run out of money. Medicaid comes in and ends up paying that. So I don't know if I answered it or I just said a whole bunch of more words. So you'll have to help me out.
No. The reason, David, I was asking is basically this is one of the reasons why we have to have a bill, and basically the part where you can kind of, I forgot the name. Basically, they have the ability for other spouse to decide how long to keep the other person alive. Say if I'm in a vegetative stage.
Yeah.
So this is very important because if you don't have that, you just basically, the rules does not permit anyone else to basically decide whether you live or you die.
Correct.
Right? They keep you alive as long as they can, extract the money from you, your house, all your belongings, anything you have in the stocks, everything except for, I think, Social Security, everything they can kind of claw in. Is that right?
100%. 100%. It is. A lot of folks do have, someone who's their power of attorney. And honestly, that gets into probably more than what we're going to do here today. But I would say, it wouldn't be a bad idea for a future session. Even if you had an elder law attorney or someone on here, they could really get into that stuff in a lot more detail than we would be able to do today. So that might be an idea for a future session for you folks. Would actually maybe have an elder law attorney, particularly a nonprofit, something like that, who could come in and really go through that in a lot more detail than we'd be able to do. Yeah.
Yeah. This is medical directive. That's what they call it.
Say it again. I'm sorry.
It's called medical directive. You basically say what,
Yes.
person can decide for me when I'm in a vegetative state.
Correct. Absolutely. Yep. Absolutely. All right. Let me dive back into these. Will Medicare Part C Advantage help cover home health care aids? Yes. If it's skilled care, Medicare covers it. Medicare Advantage, it covers it. Some of the Advantage plans will cover a little bit of the non-skilled, but again, it's not going to be a ton. And then what are the scenarios where someone younger than 65 would need to sign up for Medicare? If someone takes early retirement, is covered by a retirement plan, do they still wait to 65 for Medicare? The only way you're going to sign up for Medicare prior to age 65 is, again, if you have a disability and you're getting Social Security disability benefits, or you have end-stage renal disease, ALS. ALS, typically folks have a very short lifespan. Once they've been diagnosed with ALS, it goes pretty quickly, unfortunately. End-stage renal is one where folks, maybe they have a little bit more luxury there, as, you know, particularly if they're still working or their spouse is still working, whether or not I want to sign up. The disability is going to be automatic. If I'm getting disability checks from Social Security, after 2 years, they're signing me up for Medicare, and I wouldn't need to put that off. That's the only way you're going to be signed up prior to 65, either a disability, end-stage renal disease, or ALS. And then a couple people are thrown in, they've mentioned, living will and trust, medical directive. Again, great ideas, and actually a whole nother can of worms to open up there. But I would recommend doing, a future session where we do get into those, end of life planning, medical decision planning, something like that. And again, an elder law attorney would be the best to handle that. Anything else? Because I'm going to turn it back over to our administrators then, because I think I can still see the questions if there's anything else, but I will turn it back over to the administrators and see where we're at. Maybe we're wrapping up.
David Painter, thank you very much for
thank you
entertaining us with so many questions and answering and also suggesting some future sessions. Thank you very much, Vilasini, for putting it together via Chinmaya Mission. And thank you all the participants to make this more collaborative and useful to all of us. With that, I turn over to Vilasini for the last words.
Yeah, I think Shivaji from Alpharetta is going to say a few words, but I just have to throw in, David, this was fabulous. Really appreciate all the time and information you've given us. Really appreciate.
Thank you. And what a fantastic group. I mean, they're really making us work today with all these questions, and what a great group. So thank you everyone for participating.
Great.
Thank you. Thank you. I appreciate that, David. This is really, really very useful and of such a deep topic. As we all know, actually, more we dive deeper into this, more we discover what we don't know. So you made it very, very simple, and especially buying a car for the music's sake, that makes it, very clear in terms of doing our homework. Appreciate that, David. And Sundarji, thanks for moderating it. And Vilasini, thank you so much for initiating this. We need more of this for seniors, and it'll be really beneficial if we have more such sessions across the nation also. So I'm so happy that David from Ohio could educate us. Like that, we can have future sessions also. Thank you again, Vilasini. Appreciate that. Hariom.
Hariom, I guess we'll sign off now, but I have to mention this was all Hema Ramanathan's idea, so all credit goes to her. Okay, thanks, David.
Thank you.